So, good evening everyone! My name is Gianfranco Villachano, a student nurse from BSN 1D, and for today, I will be showing how we do the neurologic assessment. So, first things first, we will be heading to the knowledge portion. First, identify the 5 major areas involved in a complete neurologic examination. There are 5 major parts in the neurologic assessment. First part is the mental assessment. Second, the cranial nerve. Third, the sensory assessment. Fourth, the cerebellar assessment. And lastly, the reflex assessment. For today, I will only be showing the reflex assessment. And second, explain how to prepare a client for neurologic examination. So first things first, as we prepare the client, we must always tell him or her on what will we be doing next for us to make it easier for us and to give knowledge to the patient on what we are doing at the moment. And next, assist the patient on a relaxing position. He could lie down or simply just sit down. And next, ask the client to remove clothes and assist him or her to wear an examination gown. And lastly, for the knowledge portion, describe the materials for examining the neurologic system. So in the neurologic system, the materials that we will be needing is coffee. Next, perfume. Yeah. And next, pen light. If you have no pen light, you could simply just use your cell phone light. Yeah. Next, cotton wisp. And next, pin for sharp sensation or ball pen for sharp and dull sensation. Any sharp object will do. Something like this. Yeah. Next, sugar or salt. And of course, you will be using a spoon to assess the sugar or salt or the coffee once you are letting the patients use their sense of smell. And lastly, a cup of water. So we now head to the return demo for skills. So first, gather all materials needed for neurologic assessment. And next, explain procedure to the client. Just like what I said earlier, it would give us an easier time to assess the patient if he knows what to do. And next, ask the client to use clean gown. Yeah. In assessing, first ask the patient to close the eyes and occlude one nostril. Test CNI by placing object with scent or aroma near the nose and ask the client to identify the object, whether it is coffee or perfume. Test cranial nerve 2 and 3 by assessing vision and visual fields. Ask the client to follow object as it is moved in 6 cranial fields or the visual fields, like that. Test for cranial nerve 4 and 6 by assessing extraocular movements. Assess by asking client to look straight ahead, approach each eye from the client's side with a pen light. Assess for equality of pupils and reactivity to light. Assess accommodation by asking a client to stare at an object 3 to 4 feet away and move an object towards the client's nose. Test cranial nerve 5 by assessing sensory function by touching cornea lightly with wisp of cotton. Assessing facial sensations to feel light touch, dull and sharp sensation on the forehead, cheek and chin areas while eyes are closed. Assessing motor function by palpating masseter and temporal muscles as client clenched teeth.
Sharp, sharp, dull, dull.
Testing for cranial nerve 7 by assessing motor functions of the face by, for the upper face, asking the patient to raise eyebrow and observe even wrinkling of the forehead. Ask client to close eyes while try to force it open. In the lower part of the face, ask the patient to show the teeth, smile, and puff out the cheeks while you palpate for even muscle. And next, assess sensory function by asking client to identify sugar, lemon, salt on the anterior two-thirds of the tongue, with eyes closed and tongues protruded.
Salt. Yeah. Sugar.
Ask the client to drink water and observe for difficulty swallowing. Ask the patient if he or she experienced any difficulty in swallowing water. Test for cranial nerve 10. Ask the client to open mouth and say ah, and check if the uvula elevates and inspect the palate for symmetry. Talk with the client to assess voice for hoarseness and ask the client to cough to examine for vagus nerve impairment. Assess the gag reflex by asking the client to open mouth and touch back of tongue with tongue depressor of both sides. Assess cranial nerve 11. Trapezius assessment. Ask the client to sit down, stand at the back of the client, and ask the client to shrug the shoulder against your hand. Sternocleidomastoid assessment is where you ask the client to turn head against the resistance of your hand. And that is the reflex assessment. After completing the reflex assessment, don't forget to perform the aftercare of the materials. Once again, my name is Gianfranco Villaciano, a student nurse from BSN 1D, and that is it. Signing out.